Hi everyone, today I'm going to demonstrate the techniques of donning sterile gloves, setting up a wound care dressing tray, and some simple techniques of wound care to provide wound care on a patient. So first of all, before I'm doing anything else, I'm going to perform the hand hygiene. And I'm going to ensure the privacy of the patient, and I'm going to check the two identifiers to make sure it is the right patient. And then I will explain the dressing change process to the patient, and I will position the patient comfortably, and I will drape him, and make sure only the wound site is exposed. And then I will put a biohazard bag within the reach of the patient, and then I will put on the clean gloves, and then I will remove the old dressing by pulling it parallel to the skin, and make sure I do it one layer at a time. And then I will take off my clean gloves and then perform the hand hygiene, and then I will put on a pair of new clean gloves, and then I will assess the wound. So after I assess the wound, I will dispose my clean gloves into that biohazard bag, and then I will perform the hand hygiene again. So after I've done all of those things, I will open the dressing tray. I will create a sterile dressing tray. So there are a couple of things in the dressing tray. There's a drape, and there's a forceps. So this is the a gauze, and it has different sizes of gauze, 4x4. This one is the abdominal pad, the thicker one, and there's the smallest one, 2x2 gauze, and of course there's a tape. And I will make sure I put this drape underneath the tray. And then if there's a sterile solution available, I will pour the sterile solution onto the sterile gauze, and then I will put it on my sterile gloves to cleanse the wound, or I could just use a sterile forceps to cleanse the wound while I'm wearing clean gloves. So there's no swab here. If there's a swab, I'm gonna use the swab for every stroke, and I will clean the area of the least contaminated to the area of the most contaminated. And I will make sure I will change the swab after each stroke. And I will blot the wound dry with gauze. Okay. And while doing that, I have to use my sterile gloves. And after that, I will apply dry dressing. First of all, I will use the loose woven gauze as a contact layer. Okay, so the smallest one. Contact layer, or put it on the patient. And if the wound has a drain, I'm gonna place a pre-cut 4x4 gauze pad. 4x4 gauze pad. Yep. So I will make sure it sits flat around the drain of the wound. And after that, on top of that, I will apply a thickened woven pad. which is the biggest one. It's also they're also called abdominal pad. The biggest one on top of everything else. So yeah, that's the entire process.